A place to be buried quickly. More bodies keep arriving. The number of Ebola cases growing as health authorities struggle to contain the outbreak. There's no vaccine for this rare BVD strain. As well as here in the Democratic Republic of the Congo, cases reported in Uganda too. Congolese authorities say there are more than 1,000 suspected cases, up more than 100 from the day before. The dead bodies of Ebola victims are highly infectious. The head of the World Health Organization arriving in Bunia, the epicentre of the outbreak, to hold talks in the DRC today.
But while focusing on the emergency, we should use it as opportunity to build the health system, because in every crisis, there is opportunity.
On the outskirts of Bunia, where he was speaking, they are reconstructing an Ebola treatment centre. Medical staff say many people refuse to acknowledge the epidemic. This clinic was burned down by people who'd stormed the hospital, angry they could not bury the body of a loved one themselves. All schools are open. As well as hygiene, it's here they're trying to educate pupils about the disease and what they can do to stop the spread.
We cannot and will not allow any cases of Ebola to enter the United States.
The Trump administration has said it wants Americans who may have been exposed to the virus to be quarantined elsewhere. Millions of people are heading to the US for the World Cup next month. Kenya, which hasn't had a single case of the virus linked to the current outbreak and is 1,000 miles away from the epicentre, is where the US wants to send them. That's gone down like a lead balloon here. A High Court in Nairobi ordering a temporary suspension of plans to open up a facility for US citizens.
If something is dangerous for Americans, there's no way it can be safe for Kenyans. Any agreement that is being agreed between Kenya and America or any other places, there must be the public interest.
RFK, the Health Secretary of the United States, posted himself catching snakes earlier this week. The US withdrew from the World Health Organization in January. He said it was a legacy institution which had become mired in bureaucracy and power politics. The WHO said the decision makes the world less safe. While countries turn inward, those on the front line all the more isolated. Scientists at Oxford University say they're developing a new vaccine that could enter clinical trials within a couple of months. A baby succumbed to the disease after its mother also died of the virus. Women and children remain the most vulnerable in areas where treatment is scant, because this strain can be survived with good medical care. There is little hope without.
Well, a short time ago, I spoke to Devi Sridhar, who is Professor of Global Public Health at the University of Edinburgh. She chaired a 2014 panel on the global response to Ebola. I asked her about the level of worry as the virus is outpacing the response in the DRC.
Yes, I mean, already we're several weeks behind detecting even that it was Ebola. The initial tests that we have, which are for the Zaire strain, didn't pick up that there was a new strain. And then even right now, there's about a 50% positivity in suspected cases, which tells us that there are a lot of cases out there that we're not catching. And so I think there's a real worry right now that actually the chains of transmission are moving faster than our attempts to kind of break those and get on top of, those who are infected.
And the death rate, the WHO tell us, is 30 to 50%. Now, I don't think that's unusual for Ebola, but it still speaks to the urgency, right, of doing something.
Right now, real discussions in the scientific community of actually using two existing Ebola vaccines for the Zaire strain. There's worry that actually if you go in with a vaccine that has partial efficacy or potentially not enough efficacy for people to feel convinced to take it, you could actually increase, vaccine hesitancy.
You mentioned the importance of the healthcare workers having the right PPE. It seems that some of them don't.
Yeah, PPE is a huge challenge. So the way Ebola spreads is through bodily fluids. So think of blood, secretions, saliva. And so those most at risk are family members who are caring for someone who's ill, or healthcare workers who are working, in close proximity to those who are getting more and more severe and trying to save their life. And so right now, the real urgency is in getting that PPE out to healthcare workers, but also working on safe burials. We know that, some people might think you're only infectious when you're alive, but actually those who do die of Ebola, those burials being safe is very important, because actually that's another route of transmission.
Red Cross workers, on that point, are having to bury people who died of Ebola under police escort.
So it is really tricky, because it's too easy to go in with a Western mindset and just say, oh, who cares? This is what you need to do according to, transmission or public health or, immunology. But actually, it's very difficult in those situations when people say, actually, we don't care because this is what we've done, and get very angry if you do try to take the bodies of their loved ones.
The United States seems to be saying they don't want anyone with suspected cases, any of their own healthcare workers, perhaps who've been out there, to come back to the United States. They want to set up a quarantine center in Kenya instead, where there's also no cases right now. So what do you make of that idea?
It's quite shocking. I don't think we've seen something like this from, I would say, like a G7 country before. The general thing has been in the past, if you're infected, think back to 2014, that you get repatriated to your home country and you're given the highest level of medical care there. That's what happened in 2014. And so it seems really bizarre to be doing this.
Not least because the United States was withdrawn from the WHO. They would be at the forefront of this with huge amounts of US money. I mean, the US says it's putting in $100 million to this outbreak, but how does that compare to what it used to put up as a member?
Yeah, the US used to put in, it was one of the main contributors, close to $1 billion, you would say, towards, global health as a whole. So to get it cut back to this, and now it's kind of a knee-jerk response. Actually, there is an argument to be made that if those cuts hadn't been made, it hadn't removed itself from the WHO, would actually this have been picked up quicker? Could they have actually had resources come in faster? And so it is really worrisome. And it's, again, the importance of aid. It's really easy to take health security for granted until something like this happens, which is why we have an aid system, why we have these kind of agencies, and why you do, even in times of what you call peace, do need to have a system which can respond to these quickly and is funded.
Professor Devi Sridhar, thank you very much.
Thank you.